Hello everyone, welcome to wellb Live. Today I have Eva Engman and we are excited to talk about sound therapy and Reiki. I'll just pass it over to Eva so she can introduce herself to you.
Hi, sound mind and a sound body. Anima sana in corpore sano, that's my motto. And it's just the most amazing thing I've come to. I grew up in very near nature, music was all around. It was a very natural way of living. We didn't use a lot of medicine, and I guess it just came natural. And I came into massage therapy very early. But the first time I actually had the ability to let go of my busy mind, because I was always checking, it's like, oh, is he doing that? Oh, how does he use that to get that muscle to relax? I couldn't let go. But the first time I got Reiki, I felt like I was floating. And so eventually I found a person that I really trusted, because I find that is extremely important, that you have a connection with the person you're going to. We are just energy, aren't we?
Yes.
And I became a Reiki master with this amazing teacher, Ulla. And
what's her name again?
Ulla Suoko. She's amazing. She's a sound healer, amazing flutist, and always an inspiration. And I was always, I had gotten some things that she was working on me personally, and I was drawn to sound. And I actually got a bit of a sign. I was looking for a tuning fork, and all of a sudden these signs came, and there was an opening to the certification course for being a sound and music energy healer. And I ended up in what I call my tribe, people who knew what I was talking about. I didn't have to explain myself all the time. And sound is just all around right now. It's fantastic. It's really
Excellent. I know. We have a few props, and I was going to wait for this, but they're right on the table in front of us. So I think you have to show one of those, because yeah. I'm glancing at them. So I figured we could share this right now.
This is just a small part, but this is my baby. I actually work on people. Actual physical thing. I put it on the body, like I'm showing you, but on the back. Yeah. Can I show you?
Yes.
So we'll just do it like this, and we'll see if we get a sigh out of him. Can you feel it?
Oh wow. Yes.
And it recalibrates the spine in a way. It relaxes the muscles, and it's just one of the deeper tissue massages I've had, and people come out. Let you come back. We'll do that. What did you feel?
No rehearsal here. This is the first time I've ever had that done, and I can't believe I've never had that done before. It's interesting because you mentioned the word massage, but usually I'll get a deep tissue massage. I've had a Swedish before, but it's so much softer, but the vibration is, it feels like there's more layers.
Yeah.
So,
and I'm sorry, I usually I put it down on the lower back, where we usually have problems. And I find this is interesting. People who train too much and people who do not train end up with the same back problems.
Okay.
And this thing, you put it on the lower back, and people are saying, oh my gosh, I feel it up in my head. It just goes like this. And it recalibrates the whole spine, and the muscles relax. And I've had people react to, what happens is they feel calm, and all of a sudden the body relaxes, the pain in the back goes away. And this part, the lower part, the lower back contains a lot of emotions.
Yeah.
So if you're right in your head and you get this,
do you mean me specifically in my head, or most people?
Well,
right?
A lot of people.
No, well, it's come up before, especially in a city like New York, that a lot of people, right, they're very mind driven, or right, start your day and project like what you need to get done, like do, and that can get a little heady.
Yeah.
So, but it also, what I noticed was it did kind of go, I felt something in this part of my spine, even though you hit down there, and I felt those first initial physical sensations in my back. It seemed like it was tapping into I don't know if it's like your brain stem or what, like, yeah, some of the neuro aspects.
Exactly.
Yeah. Okay.
It works on the neuro. It's all. That's why I love this, the sound therapy, because it's all based. I wanted to be a veterinarian and I wanted to be a surgeon, and science was really cool. And now I get. This is one of the problems I guess I run into. Is like, oh, you're a woo, you're a witch or something. There's nothing bad about being a witch, but this is all science, and that's what's so exciting. So I think science is magic. And if I'm doing magic, I'm doing scientific magic. It's wonderful.
Yeah.
It's so exciting. The more I read about it, the more I learn how it relaxes the nervous system, and this whole thing that you just described in that short of a time.
Yes. I'm also a fan of science, and I do find it interesting, like what people feel is science that they're comfortable with, versus science that might be more mystical or more mysterious to them. And I think for some reason, vibration and resonance is falling into that category. When, or even like this being called sound therapy. Like people that think, oh, like it's just the sound, but it's not. It's the actual vibration.
I kind of still try to decide what I want to call myself, because vibrations is actually such a big part of it. So should I call it sound and vibration therapist or practitioner? It's very much so. Yeah, vibrations are so cool. I mean, and what I love about it too is that you can just receive. You do not have to do anything. It's Reiki as well. It's very safe, and I find that that's a big part, very important word today. To go to something that's safe. Can I be injured, or is it? Some people do not want to be touched, but somehow I'm not touching with my body when I do this. And I can also get a very big effect when I work with people who are actually going through cancer or MS. I'm a little reluctant at actually touching the body until they allow me to. Okay. And I test and they say it's okay. They usually say don't ever stop. But I usually try by I just did that before we did the interview. And I just do that to your sternum, and all of a sudden you go, I think you are. Do that now. But it's a really cool, and I'm not even touching you, so it's extremely safe. And that's why I find this to be such an exciting modality.
And we've been in, I was telling you, I was at a yoga class last year, a restorative yoga class, where they had an instrument and they did go around, but it was near, it wasn't touching the body. So perhaps people have experienced some form of sound therapy connected to another modality and they didn't realize it, or it was just something to accentuate the other experience they were having. But most of us have experienced it in some way or another, just maybe not specifically setting out for a sound therapy session. So, but someone like you, through your path, you've kind of honed that direction, or how to bring that type of healing more to the forefront. So how do you find that being accepted by other people? Or do they come to you directly for that, or they come more for the Reiki and then you introduce the sound therapy to them?
Yeah, that's good. Yes, I mean, most people who have been introduced to this are doing like a sonic soak or a vibrational journey or whatever. It's called different things, or a sound bath. And that's when you usually have that experience that you were talking about, when somebody goes around. I usually sing, I use tuning forks, and my colleagues and I are using whatever we do. I mean, I use my voice a lot, I might use a drum. But and this baby, this big one, I usually, if I feel that there's a bunch of people in a sonic soak, I will go around and just kind of sense where people are, and they get a little, up here around you. I feel like, okay, you need a little vibration there. When they come, your direct question, I'm usually searched out for Reiki, and then I say, may I try? I usually say Reiki 3 times, one for the body, one for the mind, and one for the mind and body to work together. And so I usually start out slowly with the sound, unless I have someone who's used to this. So yeah, Reiki is what I'm called for, and it ends up actually in the 3rd session. So sometimes it's almost only sound. Like maybe just start and begin with a little bit of Reiki. If you don't know what Reiki is, you're using your hands very gently to move energies, and this just aids. This was actually what I used for my graduation. I had a lady who was MS, and she allowed me to work on her, and it was extraordinary. She was very open, so she was a very special client, but started with Reiki, and I said, let's try the sound, and she said that she felt very good about it, and I'm very honored to help that way.
So what, you can either refer to that client again or not. What's one of the things that they'll say, right? Like, is it instantaneously in the session, or do they come back to the next session and share with you what the experience was? Is it immediate? Is it long term? Both?
Both.
Yeah.
Both. That's what's so exciting. I just did something the other day for someone who had never thought of going and having. I don't really want to call it alternative, but complementary therapy or this modality. And I said, can I just please help you, because you're very tense, and do you mind? Do you want? And she was kind of getting curious. So that was in 10 minutes. Which is, I said, I'm not going to overdo this, I'm just going to give you a try. And she just went, yeah, well, oh my God, what happened? I did a little session with a group in Central Park yesterday. I just brought some of my little bowls, and we just gathered, and I just had them, they helped me holding the bowl, and they all, yes. So we're doing this kind of stuff. I know, so you have to have it straight. I'll bang it a little bit, because if you can't touch the sides, then it won't ring. So it's like, and they all said, they just stopped. That you could tell how their breathing went down, and they all said, we have goosebumps. It was so wonderful.
So this was in the park too?
This was just in the park, and I did it for less than 5 minutes. Okay. And everybody came down to a point, and they get this smile. It's such an honor to see this smile that happens to everyone doing this. And then they will call, I ask them to call back and say, you know, if you have any questions. And sometimes somebody has so much toxin going on that they will say, oh my gosh, I had heart palpitation. I had this thing happening. No, it's okay. Just breathe through it. It's okay. It's okay. I mean, I don't want to do anything, and I'm not the healer. Your body is the healer. So you have to be patient and accept what happens. You know, drink your water. Call me if you're afraid. Like this lady really got heart palpitation. I said, what did you do? He's like, well, I didn't rest as you said. I actually took a really fast walk up some set of stairs. I'm going, hello. You know, so be kind to your body. It's we're looking for miracles. We need to be patient, because it took us a while to get here to the place where we might not feel so good. And it's going to take a while for the mind and body to communicate and said, oh, I like this place. I've been here for so long. You need to reprogram this computer, this divine computer we have. So just be patient, be accepting of what happens.
And I like that you use the word complementary, right? You know, some people still use the term alternative, but oftentimes alternative will indicate that it's like you're doing one thing and then so, oh no, try this instead. Whereas complementary is try this in addition to. And back to what you just said about the gradually getting to that place where somebody is regarding a physical ailment or something that they might want to get rid of. It's like it was a bunch of factors that contributed to that. So more often than not, it's going to be a gradual bunch of conditions to change it, like to either dismantle that or to realign someone. So that's something too that we have to remind ourselves that it's like, yeah, it may take a little bit of time, a little bit of trying, but it's fun, right? Like sample, like see what works for you. And it could be the sound therapy, it could be other aspects of Reiki, or you know, the combination of the senses, right? Not just touch, but sound, aromatherapy, like right, all these different things that are out there, and sampling each thing, and then just see the combination that works for you.
You brought up something extremely important, that usually this, or most of our modalities that are mentioned, like Reiki, you have this immediate effect of feeling really cool. It feels really good. It's like, yummy, yummy, yummy. And then you come back, and then the body and mind starts to just like reprogram, and it's kind of unpleasant. Or if not unpleasant, it's like, nothing's happening. You know, because you hit it like a plateau, and in anything we do when we study, and this is for our bodies, we have a truth that we've been believing for so long. And you need to say, well, this doesn't serve me any longer. So the thing is that I think most of us practitioners run into is that we get a great fast result, but the continuing journey that is so much fun that you were pointing out does not continue. It's like, okay, I buy a package of 3, and then I don't come back because now I'm healed, now I feel really good. This is good enough. And that's when the fun starts. I love that you use that word. And you don't necessarily, like you said, have to stay with me or this modality. The modalities we all do in this group of people that are connected now, I usually say that it's different languages that lead to one understanding. And you know, it might, and it might actually be so interested that you go into other things to just make this even more valuable for you. And somebody might say, I don't like the way you work with me, and that's okay.
Or they did at one point, but then they, like, because I'm a health counselor, and sometimes different people's approach or style just works at different points in your life. I've had different counselors or coaches that some were very gentle, and some were to tell it like it is. And there were different points in my life where I really needed to tell it like it is, like just cut to the chase. And then other times I was just like, no, or even like massage, right? The Swedish massage versus the deep tissue. It's like, it's okay. It's like, it's selection, right? You're choosing one thing, and then the other thing you can always go back to. By having experienced it, you have your own experiential knowledge of what that was like for you. And you should be able to decide at any given moment and being in touch with your body and where you're at and say, I don't need that right now, but I may in the future, or right now, what do I need? What can I explore? What's good to try out next?
And as healers, you know, people always also, there's another thing, I always get questions, what did you feel? And I was like, no, it's not about me. It's about you. You are the one who's there out there. And so I usually cut the after experience. I just want to make sure that you're not dizzy and that you're safe to go out in the world again, because it can be very overwhelming. But I'm not going to tell you what I felt. I know what I felt. I know what I can do as a healer, but I want to know your experience. What did something come up? What can I help you with? And if you say that, well, your style doesn't work with me anymore, it's not, I'm not going to be upset. I'm just going to wish you the best. So, and then you might come back because it's like, okay, I like that kind of stuff going on.
And it's great. Like you kind of mentioned this before because the thought is coming up again, so I'll share. I was just in Sedona, Arizona, which is a very healing place for me. It's just got a great vibration, beautiful place. And, you know, so I work as a health counselor, and I'm aware of different modalities and how to help people. And for some reason, a thought that kept coming up for me was something that I was taught years back, but it's the phrase, instead of the sage on the stage, you're the guide on the side. So, and I'm very aware of that, but you know, sometimes I see, it's like, who am I to help someone else? You know, it's like that egoic part of people that can kind of they want to be on the stage and say, this is what I'm able to do, but the detriment with that is that people get out of touch with their own power to heal and with their own sensibility. So you want to be the guide on the side. You want to just be able to be the one that's doing the modality for them, and to just be in that role to hold the place for them and have them, it's their experience, right? And there is this intricate fine line, because of course you're going to sense something as the giver of the experience, but like you said, it's not about you. But thanks for articulating that, because I think sometimes we'll see like a documentary or, you know, somebody on a TV show, and then it is more that stage on the stage, but that's just because they have to express what they're doing.
Yeah.
Exactly. It is a
different.
performance.
Yeah.
But in the actual experience of a session or with somebody else, right? It's you're trying not to be there. You know what I mean? It's almost like you want to be invisible, but you can't. So, but that's something too that I think a lot of times somebody comes in, they have the experience, and then they walk away, and it's like, well, why weren't they telling me more what to do? And that's also a lot of the medical model.
Why didn't you tell me what to do? Exactly that.
Yeah. So
That's
have
not
you?
what we do.
Yeah, exactly.
That's
So
not
have
what
you
we
had
do.
experiences like that where somebody?
Yeah. They get almost mad at me, and I was like, no, this is you. And then I have to explain that this is your experience, and that's usually a person who doesn't really want to go through the work, and is a little scared. And try again, and the same. You have to tell me what you felt, and what should I do, and what happened. I'm going, no, and they usually, I'm not for them.
Yeah.
I have though a wonderful little thing you remind me of. My teacher Ola said to me, because I am a performer, I love standing on a stage and singing and wailing and doing all these things, I'm a classically trained singer or whatever. But she said, in Reiki, in sound healing, you leave the diva, Eva the diva, outside the door, and Eva the wise woman comes in. And I remind myself every single time, leave Eva the diva outside, Eva the wise woman.
Yes, and we all have both sides.
Yeah, of course. I mean, otherwise we wouldn't want to do this, because we are helpers, we are performers. We want to bring people in, we want to talk about this. And it's in a way, it's a performing, I haven't never thought of it that way, but maybe it's a performing art, and it's art and performing, I mean, it's all goes together. We want to have a thread of building bridges, and this is one of the things. I can sing and I can try to make a person feel better by my vocal vibrations. Music is great, but sometimes I find this is so great too, because somebody explained sound healing to me that all these overtones and things, the brain can't really process it. So it says, oh, forget about it. And it relaxes. Whereas in music, I go crazy if I'm in a spa and somebody has this music going on. And I actually freaked out one time because there was a singer, and I'm lying there when I was supposed to relax. And I'm listening to her off-pitch singing, and I'm going, take it away, take me out of here. It's awful. So we also one thing, we have to meet our clients on that level. You said sometimes you need to tell it as it is, and sometimes I rarely these days use cool music. I have a lot of musicians that work with, and they are listening to what the flute player is doing. So this is great because they can't judge. They can't go into and say, oh, the pitch was off there.
Whether they want to or not, sometimes, right? Sometimes their mind is just automatically doing that. Yeah.
So I told someone recently who was an amazing musician. I said, please try not to hear the intervals. Try to blur it out and try to just accept. And he supposedly liked it a lot. But it's I don't always go for the music, the relaxing music. Sometimes that drives me nuts. And the person who's really wired would not want to have that. It's like, take it away from me, like me and that.
Yeah, you don't know how it's
going
to show up for them in that
So
moment.
we have to be very, aware of where we're walking in and where our clients are.
Yeah, and a simple way to do that is by asking questions, right? So I imagine, right, even though it's sounds and even though it's Reiki and energy, you do have discussions with your clients. So you ask them questions and they respond back. So
and when I introduce something new, like this thing, I was like, please talk to me. Does it feel good? I mean, everything has to feel pleasant and make you come down and relax and feel, have renewed energy. And this is what's so cool. I've worked with people who are actually on cancer therapy and have totally been drained walking in to a point like, oh my gosh, am I going to be able to help you? And after 4 times, they come back, or this person particularly said, I feel so energized. He fell asleep. But the second time, he was also kind of skeptic, but he tried it, which brave for him. And he says, I'm coming back because I sleep on the table, and then I can go straight to the training and the exercises that I'm supposed to do for my cancer treatment. And he went, in 4 times, he went from being gray and really run down. It was such a joy to see that this complementary
that's
thing
another
can
great
help.
example.
Yes, where Western medicine, everything is great, but you get so stressed by taking all these medicines that if you cannot get to, so the amygdala, that little amygdala guy, who's like, there's a tiger running behind me, I gotta dash out of here. And you need to come down to a point where your body can do what it does best, which is heal itself. And if you're stressing your body, you don't feel, and people say, oh, I'm not stressed. I was like, yes, you're stressed because you're taking all these, medicines. And so, yeah, that's why it's such an honor to do this.
Yeah, I like that, like in terms of not just complementary, like, oh, one day you do this treatment, the next day you do that, but like segueing into the treatment, right? If you have cancer therapy or some type of treatment that you're already taking, like why not look at the before and after of that process and see how these complementary therapies can help you with your current treatment?
Yeah.
I love that. Like
Yeah.
it's just, and I don't think people will think to do that. You know, it's almost like the difference between taking action and maintaining action.
Yeah.
Right? When we start to take action, I think some people are just happy that they're getting a treatment or anything, right? But then once you are doing that, that's when you it's a regular thing, then you could start adding and see what's going to be the best way for you to maintain those treatments in your life and to make healing actually happen rather than just going through the motions of a treatment. So, wow, this is a lot of stuff to think about, even for me, because like I said, I'm usually
I just
a lot
have
of.
to say that one thing you said to think about. That's one thing I also want to add. That we are so in our heads.
Yeah, well, I'm a thinker. Yeah.
Yeah, so am I. I mean, goodness gracious. But our bodies have so much to tell us.
Yes.
So I just feel like let's listen.
Yeah, for sure. No, but that's when we talk about awareness. For many people, it's a contemplation process initially. But when you experience it, that's when it starts to marry between, like you were saying, you have the Reiki sessions of body, mind, and then both together. So I think people are at different stages in that process. So some people are thinking about it, or they take the information in through how they can contemplate it in their lives. But then, you want to actually experience it, see how it resonates in your body, see what feelings come up for you, and then if you want more of that feeling, then you do more sessions.
Right.
Yeah. So what's a common thing that people want to, I guess, heal when they come to you? What's a big thing that comes up for your clients? Like something that they articulate that they're concerned about in their lives.
Well, if you're not in a treatment or anything like that, I guess stress and the way, like in this person recently didn't realize that the stress was actually causing a physical problem. So you actually come to me for, I was like, I have this backache, and suddenly you realize that no, it was up here, it was my head. So I think the physical thing is what people will come for. Stress, I can go and do this, I can do my manicure, pedicure thing. But the thing also that I would like everyone who wants to go to this kind of modality, make sure that you feel like the person is really focused on you. As a person, as a woman, when I go, if I have manicure, pedicure, or a massage, I will walk out and never come back. If I feel like they're talking to someone, if you're sitting in those little chairs, they have a massage. I don't know how many people I've left by saying, you're not focused on me, you're talking to other people. I can feel your hands not being focused on me. So be an educated consumer. Not all people, well, you make sure that you go to someone who's certified and all these things too. I think that's important. And also feel how you feel. Are they focused on you? Because you're there, and that's the only thing that matters. I should be there for you. And I want, yeah, that's it.
Can you show us something else with one of the bowls here?
You can help me out a little bit?
Yeah.
Yeah, so you get your two hands here. Yeah. And then hold it straight so you don't, there, so we'll do a little sound. See if this works, if I do it. Oh yeah, cool. So I'll do a little big bend here. And then I'll do, oops, too much. This one is, I'm going to try not to make terrible noise for this now. Now we can take this one and just do this. This is a little bit. How do you feel?
Well, initially, I don't know if it was because I was a little nervous. I felt my heart. I felt like a lot of energy right here, and then when you did the other one, I think I was just surprised with how it wasn't loud, but it was
Sonorous.
Yeah, it was just, there was a magnitude to it that I wasn't expecting. I was almost like, is that coming from that? But believe it or not, then that kind of just, whatever was going on, a little extra in the heart area, it kind of felt like it dissipated, and then it just like went to the rest of me. And it was like a good energy, almost like that expansiveness, rather than it being stuck just in one area. So I that when you went like that, it kind of opened it up.
This is so interesting because you're so open. You know these modalities. This one you haven't tried, which is so cool. That you're so wide open, so you will have all these words for it.
Yeah.
But it's also exciting because we can show how fast you feel, and especially with this one that took you completely by surprise. That it actually, you go, whoa.
Well, that's what happens. Like we can articulate these experiences with the new modalities from other things that we did. So I mentioned I was in Sedona and I went hiking, and there was a similar expansion feeling. It was just like, right, you're hiking, and then your heart's racing a little because you want to go. If you're open to it, you want to see what's there. But then your body is physically doing something, so you're feeling the body move. But then when you stop and you kind of take it all in or recalibrate, and then because it was so beautiful there and I was open to it, you do feel this level of expansion. So perhaps like having just had that experience, now I'm able to see that that's what a similar thing. It's different, but a similar, like I said, almost like not a full blockage, but like the energy in one space versus what it feels like when I said like it either dissipates or is able to find a path to flow. So yeah.
Isn't it exciting?
Yes. No, it's great, and I really appreciate you trying this on me and being delicate, and we're being live, and but yeah, we should do more videos of specific processes like this. I'm sorry, I'm trying to find words now. See, this is what happens to me when I do these sessions. Yeah, I walk away not wanting to speak anymore.
But that's what happens to me when I go to one of my colleagues who do sound baths, and it's scary going out in the world after because I get so woozy, and it's wonderful. I'm like wide open, and it's a little hard for me to, because I am an empath. I'm very, very sensitive to things, and sometimes I just close down, and sometimes we also forget our own tools when we need them. But going to a sound bath, and even when I do give one, and we have a whole group and people come in, and it's not in one-on-one, but everybody's part of this particular energy that day. I get part of it too. I mean, I have this smile. I walk home on the A train, and I'm like, yummy, yummy, yummy. If I've gone to one, I have walked into not light poles and all kinds of stuff. So I'm like, so you should make sure that you're.
Well, that's a good segue on closing here. And we just.
Oh, did we have some?
Yeah, just good demonstration. So thank you. And so then what's I was going to ask you to give a suggestion to our viewers about something that they could do at home, but then maybe you can add that, like just for their own preparation, but then also like what would be a good tip on, like you said, the follow-up, because maybe some people are concerned about what we were just talking about doing a modality like this, and then what is their segue back to reality, whether that's the A train or walking down the street, right? Are there tips for that, like prep and follow-up that they could take so that they feel more comfortable going into an experience like this?
It depends on you, but I think first of all, be gentle. Be gentle to yourself after you've been through this. Just really make sure that you're okay before you leave the place where you've been, and also your practitioner should make sure that you're okay too. But I just, like now there was a horn outside the window. These sounds can sometimes get very, very clear and almost painful, and that's when you come from a place like that. Just let it happen. Let it go through you, and don't fight it, because that way you're going to lose the yumminess of what you've been through. But you also need to carefully come back into reality. So if you can, I wouldn't recommend going through a major sound bath or Reiki and run back to the office. It could work, but if you know that you're a sensitive person, I would make sure I have a little time to come down. You have to always drink a lot of water, because there's stuff moving through you, and you end up with a headache if you don't. But it's just be gentle.
Yeah, I was thinking similar to like when someone has a massage, certain times, right? Like just you can go to the waiting room, or you can go into the sauna area and drink water. So yeah, there's definitely for each individual person, afterwards they can go through like their own routine of how to kind of readjust.
Just be kind
but
to
I like what you
yourself.
said too, because I have noticed that with even sometimes just doing a workout. It's like when you're so present in the moment of whatever you're experiencing, and then you go outside, and then something goes by, like the siren seems louder, or it seems near, or it's like, what is that? And then it's just like, but I like that you said just let it go through you, like just let it pass through you, and then because it's a temporary thing, and then before you know it, then you don't want to completely lose the feeling of what you just experienced.
No, you want to sit there.
Exactly. You want to incorporate that into your vitality.
Yeah.
So.
But try to be friends with the chaos. Somebody said, and it's nice. Just don't feel like these terrible sounds are attacking you, but rather they're just part of life in the city. This is what we have, and this is why I think going to where you were, and me going out in the woods and just listening to the silence. Yeah. We need that, because we are taking so much in, and sometimes we come to a point where we just can't let it go through us. And that's when you have to take a step out and say, I got to take a downtime here. I have to do what you did. If you can't
it's almost like we're dense.
Yeah,
so that's...
and you can go to Central Park if it's that. And just go somewhere where you can find a little spot where it's not too much going on, and just. There was a great thing when I first came to the city, and I was so overwhelmed with people and the subway, and I read somewhere, it was great, it was like, breathing in, I calm myself, breathing out, I smile, and know that this moment is the only moment. And it's like that.
Excellent. That's a great tip. Thank you for sharing that one. So yes, anyone can do that in the comfort of their own home, or walking down the street, or in the park. Yes. So thank you so much, Eva. Eva is will have her sessions on the wellb app. So if anybody wants to have a session with Eva, just check out wellb and book a session with her. And I appreciate so much this experience, the demonstration, and learning more about sound healing and all the Reiki goodness that you have shared with us. This was wonderful. Thank you so much.
Thank you.
Thank you.
Thanks everyone for being there.